Namaskar and welcome to Changemakers. I'm Shubhendu Ghosh. India has completed 75 years of independence. Women of this great country have been equal stakeholders in its progress, and now the nation must also come together to empower our women. Today, let's talk about prioritizing women's health. Health challenges faced by women are diverse. Sometimes the problem gets aggravated because health solutions are either not accessible or affordable. Also, many times women fall victim to archaic belief systems, taboos associated with their body and health issues. Our change makers are transforming both the health solution as well as the perception associated with women's health issues. From comprehensive nutrition support to non-invasive breast cancer detection to compostable and affordable sanitary pads, our change makers are bringing attention to the issue of women's health with dignity, sensitivity and innovation. Our change makers have made immense contributions in the field of women's health by grassroots efforts and state-of-the-art innovations. Dr. Leela Joshi is an Indian gynecologist and social worker known for her work with tribal women and teenage girls suffering from anemia in Ratlam district, Madhya Pradesh. Her deep sense of service helped reduce maternal mortality rate of the entire district. Dr. Joshi began her career as an assistant surgeon with Indian Railways. After retiring from active service, she moved to Ratlam district, where she started providing free healthcare service to tribal women and children. Unlike usual healthcare initiatives, Dr. Joshi formulated a result-oriented program that not only involved prescriptions but also follow-ups to ensure success. She was awarded the Padma Shri for her work amongst tribals in Madhya Pradesh. Our next change maker, Niramai, has developed a novel software-based medical device to detect breast cancer at a much earlier stage than traditional methods or self-examination. Based in Bangalore, the startup is founded by Dr. Geeta Manjunath. The solution is a low-cost, accurate, automated, portable cancer screening tool that can be operated in any clinic. The imaging method is radiation-free, non-touch, not painful, and works for women of all ages. The core technology has been developed using patented machine learning algorithms for reliable and accurate detection of breast cancer. This unique solution can be used as cancer diagnosis test in hospitals, for regular preventive health checkups, and also for large-scale screening in rural and semi-urban areas. Our third changemaker, Aakar, is an internationally recognized hybrid social enterprise that enables women to produce and distribute affordable, high-quality, fully compostable sanitary napkins within their communities, while simultaneously raising awareness and sensitization on menstrual hygiene management. Aakar's product, Anandi Pads, is India's first and only patented and certified 100% compostable and biodegradable sanitary pad with bio-Oscars from Germany. Based in Mumbai, founder of Aakar, Jaideep Mandal, is a leading figure in menstrual hygiene and health sector globally. With rich experience in menstrual hygiene, rural innovation and micro-enterprise development, his work is acclaimed by several governments, World Bank, UN organizations and others. Those were some inspiring initiatives. Time now to meet our change makers and learn more about their work, vision and innovation. Let me welcome Dr. Leela Joshi, veteran gynecologist, Dr. Geeta Manjunath, founder Niramai Health Analytics, and Jaideep Mandal, founder Aakar Innovations. We saw your remarkable work. A warm welcome to Changemakers.
Thank you very much.
Thank you.
Now, each one of you has done inspiring work in the area of women's health, but there must be so many psychosocial barriers that you had to overcome. Nutrition, women's nutrition could be a gender issue. In some circles, talking about women's body from health perspective, whether it's breast cancer or menstrual health, could be a taboo. How did you break these barriers?
We are doing the health checkup and anemia status in adolescent girls, and it was so surprising that we have a full team of our school health checkup, and our team, we give them a tablet albendazole, and our team people were very much anxious, in fact confused, why under the similar condition hemoglobin of a boy rises but the hemoglobin of the girls does not rise. So one day one of our team members called me, madam, just see. Then we found that these girls taking albendazole is a chewable tablet, and these girls and our team, after giving the tablet, makes them water to drink, and even then these girls used to keep the albendazole tablet somewhere in the mouth and just spitting out. So our team members came, madam, please see what is there. I found that all the tablets were just spitted out. So that is one reason. And then I asked every girl, what did you eat? Invariably the reply is, no, we have not taken anything. Okay, you did not take because you get the midday meal also in the school, that also we don't take. Then what do you do? They say that we go home and then take. We found out why. Because their mother has told them not to eat outside. We do not know who prepares that food. So that is not applicable for boys. There are so many such problems.
Right, absolutely. Dr. Manjunath, ma'am, your experience of dealing with the taboos and the barriers associated with women's
health. Yeah. I mean, especially for breast cancer, it's really a big thing. So I recall, there have been some talks because our test is very innovative in technology standpoint, AI. So if I give the topic as AI for breast cancer is my topic, suddenly I see the breast removed from the list. It's like a scientific conference. It's AI for cancer. I said, why did you remove? So it starts from there. Okay. And then of course, I've gone on stage and said, breast is also something like your hand. You don't mind talking about your hand and leg. And if there is an organ which can kill you, why can't you use that word? Starting from there, I used to do this. Now it's little more easier to talk about, it's almost like I become synonymous to breast cancer in many, many forums. That is one aspect of it. People have to, but when you actually talk to the rural women, like ma'am was saying, when we do lots of it, we've done thousands of, screening camps for women in rural and urban poor and actually corporates and all of these places. When we actually go there, especially in rural women, when we go there and talk to them about, do you have any lump? This is how it is. And you talk to them, you touch them if required and all that. Then they're so thankful. There's somebody at least who is able to listen to them and treating the organ as an organ and not like a sex symbol or something like that, right? So we've had so many people, some people have actually come and almost touch my feet. I said no, it's just a normal thing. So that, there is a need for the person to feel comfortable about talking it, and we need to create that environment. Early detection means, you are taking care of the whatever disease in the best possible way, reduced treatment costs, reduced, health problems after that, and definitely, much more better life and more people living longer. We use the word breast health and we never use the word breast cancer, because cancer itself, makes people run away from any camp.
Right. And Jaideep, fortunately, conversations around menstrual health, hygiene have started in our society, in our classrooms and elsewhere. But you're also working with a lot of rural communities. Give us an insight into how difficult, how challenging was it for you to begin your work, reaching out to them and informing them about menstrual hygiene?
No, but like so from the day one, it has been like challenging, but slowly like we had gained some tractions there, finding some methods which is like from all driven from the field. A couple of I think insights I'll give. Like one thing, as you all know, so having kids are very important for everyone in our Indian society, especially in the villages. And but then like majorly women as well as men do not even know there's a huge connection between menstruation and childbirth. And now like so men always neglect the women in the family while they are menstruating because either they said they cannot cook or they have to stay outside, they cannot go do so many activities or go to temples or masjids or whatever, but then they are not being supported mostly. So now once you explain to them the very simple fact that if a woman is not menstruating, that she cannot have babies, or if she is like during her period, if she is not being taken care of well, she may have complications and that can lead to again losing the child. So that very simple connection makes a lot of difference for the men, and that has helped us a lot because so when suddenly they realize, oh no, this is so important, if I don't take care of my like woman in the family, then like I might lose the most important thing in the family. So that is one very key part.
Right. Wonderful. So now let's talk about each of your work in particular. Dr. Leela Joshi, we all know you've done commendable work as far as health of tribal women, girls are concerned. In Ratlam, Madhya Pradesh has been your Karma Bhumi. Tell us about your experience tackling anemia, your journey while engaging with the tribal communities.
In fact, the map of my journey, as I said, was even before I was born. It was determination of my mother. In spite of, on an average family, she could make me doctor at that time. I passed in 1961. Then I had been in a railway health services, and I had been posted almost in every part of country, and I have witnessed pregnant mothers dying because of anemia. So the thing has come in my mind. It is a totally preventable cause, that was in my mind. And after nearly my retirement time, I was posted in Assam, Guwahati, and it so happened that I had met Mother Teresa in one of the functions, and then she told me, "Doctor, please do some." I was confused. I was at the verge of retirement, and I was just thinking where to settle. And mostly my colleagues, my friends were advising me to settle in metro cities. But then I met Mother Teresa, and she told me, "Doctor, please do something for them." There was a group of tribals sitting there. She caught hold of my hand and told me, "Doctor, they are very simple persons." And then I did not look back. I did not think of anything else. And I had come to Ratlam because I knew that it is a tribal area. And I came here in 1997. And very soon, I feel that there are so many persons in the society who want to do something, who want to give back to society. And there was a good number, mostly they were retired teachers. Like me, I was also retired. And we started holding camps, health camps for tribals and underprivileged women.
Right, Dr. Joshi, also give us some insight into the tribal communities that you were working with. We know that tribals have a very deep sense of community, passing on the knowledge, passing on the culture. So the health advice that you were giving to one generation, did you also see that being passed on to the next one?
Mouth-to-mouth publicity was very important. The number of camps, the number of the patients attending the camp, because they were benefited.
Right.
by our camp. And as far as the generation, then after doing taking care of these pregnant mothers, we did realize that they are already anemic, and even in the first pregnancy, primi gravida, they are severely anemic. It is not only the pregnancy, but they were anemic from childhood. So therefore, after some time, we thought that we must, if we don't care for these adolescent girls, then our work will be incomplete. We have to prepare a healthy, non-anemic mother. So we have started health checkup camp for the, as such, for the children, but mainly for the girls, for the adolescent girls. And we name our project as 12 by 12 by 12, meaning thereby that hemoglobin of every child should be 12 gram percent by the age of 12 years. And if it is not possible, then at least by the time she reaches to class 12th. And we have covered more than 3.5 lakh children during this period. And very important thing, as our brother also told, that you have to follow them up. One time action is as good as no action.
Dr. Geeta Manjunath, if I can come to you, ma'am. You've been a computer scientist by training. How did this shift to health services happen, and that to something as advanced as breast cancer detection?
Yeah, so yes, I am a computer scientist, and I used to be at Hewlett Packard for 17 years, and then I used to head AI research for Xerox before starting Miramai. Actually, we were working on several problems where AI can be used to solve and make the life better, global problems as well. Then around that time, one of my cousin sisters got detected with breast cancer, actually. She died as young as 42, and so that's when I really was shocked to see the impact and the effect of breast cancer on women in India. And I was also shocked that over close to 1 lakh women die every year, and this is one of the most quote unquote curable of or manageable of all the diseases of cancer particularly. So and then I saw a couple of other cases in my extended family, and that's when I started this research with my help of my colleagues and so on. And later I said, I'm going to do this full time and quit my job and do this. So it's been about 6 years, close to 6 years since we started. I think we've come a long way. We've used technology to actually enable early stage breast cancer detection. We just measure the temperature variations on the chest, which 400,000 temperature points, 4 lakh temperature points per person, and that can only be analyzed with a computer. So my background and all that really helped to look at this as a computer science platform as well, where we look at temperature distribution and convert that into a breast cancer report, right, or a breast health report, to say the least. And so we are able to automatically detect abnormalities, particularly also talk about the probability that it can be malignant, which is cancer, and also mark the area of likely abnormality, so that a follow-up diagnostic workup can be done with an ultrasound or a mammogram, or of course a biopsy is the final ground truth. So all this completely done automatically with a smart software is something that first time in the whole world. We have 29 granted patents, made in India product, and we're getting approval in US. We've got approval in the UK, and Europe, and we've launched a program in UAE as well as Africa. We'll start in Philippines and other places. So it's like I feel like there is an opportunity to really detect early, very privacy environment, and that's so important for India. Where in our test, the person just sits in front of the device. She actually goes into a room, closes the door, and removes her clothes. Nobody is inside the room. She just sits in front of the device alone for about 10 minutes. And the technician is also, so she gives instructions to turn left, right. And that's about it. Her report will be ready within 10 to 15 minutes of the whole procedure is completely completed. And this test can be done either inside a hospital, or you can take it out and do the test in rural areas, corporate offices, and we've started home screening as well. So if anyone wants to do screening, they just come to our website, niramai.com, and register for screening, and we send them home within half an hour. Her test is done at home, especially during COVID. This is very, very important. So all this is possible because of automation, and it reduces the skill needed to do the test itself, skill needed to interpret the test itself. And it's a screening program. We are not saying we are sort of, removing all other tests, like Mr. Monroe was saying, everything exists, right? But everything has its own place. So if you want to, detect early in stage 0, stage 1, and just take her so that she can live much 30, 40 years, if it is stage 3, even staying for 2 years is 50% chance. It's that's bad. The stage 0 is the stage 4 can be, or stage 3 can. So that is what we want to change. And as a techie, I'm very glad that technology is making a difference. And as a human being, I'm so glad that, at least part of my life, I'm able to do something which has both social impact, also some people think business impact, and many people consider this as a breakthrough for cancer screening, hopefully.
Absolutely. And that particular aspect, that the health solution that you're providing is non-invasive, it protects privacy. These two aspects, how crucial have they been for the women, the girls who come to you for advice?
Definitely, for screening, these two have been very, very critical, especially in rural areas. When we go, we just say, okay, you just have to, we explain to them what they have to do, and the person is outside, they feel very comfortable doing it. Even in corporate offices, we are able to do it, right? People just take a 15-minute appointment, come out as if they're having coffee, and they just do the screening and go back in their own conference rooms. And this is hugely, hugely important for, conformance to the regular screening that's required, as opposed to compression and somebody else pulling their breast, putting between two plates. It's a very, very clumsy thing, which women would like to avoid if they can. Of course, if there is an abnormality, we go through all the tests that's needed. But for general screening, this is very important. And just a point there, I was in Dubai 2 weeks ago, and they just love this solution, right? Much more than India, we're seeing much, much more important, because even if the government has all the money to put all the sophisticated machines out there, only 13.9% of women are taking up this because of this privacy issue, right? And with this, they really love it, and everybody is like, they just immediately called me for their, news channel like this and so on. So it was really, so many women around the world also benefit, definitely in India, and that's our main goal anyway.
Right. Jaideep Mandal, if I can come to you, if you talk about Akar Innovations. Jaideep, you're doing transformative work in the area of menstrual hygiene. The sanitary pads that you are making and providing, they're both affordable, and they're also environment friendly in the manner they're compostable and they're biodegradable. How crucial are these two aspects of the work that you do?
We work on two aspects in sanitary pads. One is the health and another is the environment. So let me talk about the health aspect, which I feel is more important even than environment. And so more than 60% women who have used sanitary pads, they have issues with the rashes, infections, and many a time it leads to further things like which are more horrible and dangerous. But at the basic level, rashes issues and infection issues are very common about majority of women. But then although it happens, there are two reasons many do not understand. One is that this is a taboo topic, so no one really talks about this in open, even if they know that this is happening by sanitary pads. The second thing is that many do not even understand. They feel maybe because of their own personal hygiene, which is let's say using the clothing, underwear and other things, this may have happened is not because of sanitary pads. So they ignore that. So, but then this is what is happening. And then what we have brought a solution here is that there is a super absorbent which is there inside sanitary pads and also diapers. I give diaper example because it's more relatable and easier to understand. So everyone, babies who wear diapers, they have rashes. This is people have taken this as granted that diaper pehnenge to rashes hona hi. So so the core reason behind is the super absorbent which is there inside the diapers and sanitary pad. It's a chemical polymer. And just for information, this same thing has been banned by US FDA from tampons, which is also a menstrual hygiene product, 20 years back, because this product goes inside the body, inside the woman's vagina, and then that's how this is a regulated product, even in the US, but then class 1 product, whereas sanitary pads and diapers are not. And then they have been allowed to use the same super absorbent in the diapers and sanitary pads. So what we had done, we had replaced this chemical super absorbent with a natural ones, which is made out of cellulose. And that removes completely the chances of any rashes, infection, irritations, and all of it. So it makes it more healthier.
And this is also the second aspect of menstrual hygiene, safe disposal of
Yeah.
menstrual waste. That is something that we often don't talk about, and we often don't hear solutions about. And there, I think your product is also making a difference.
Yeah. So that is the second aspect apart from health, is the environment aspect. And there is so we had made back in 2012-13, when no one had been talking about this across the world. Like, we made the first compostable pads, and there is a difference between biodegradable and compostable. Let me just reiterate that, because people are being fooled by many companies at this moment by these words. So biodegradable means anything which is which degrades naturally. And but then it doesn't have any timeline. So it can happen in 5 days, 5 months, 5 years, 500 years. So by the definition, scientific definition of biodegradability, you can call it as biodegradable even if it takes 500 years, because the definition doesn't have any timeline. So that's how people are being consumer are being fooled by using the word biodegradable. Whereas compostable means within 90 to 180 days, the materials or the product will become part of the soil and maybe even manure, without harming the ecosystem, environment, or the health of anyone's body. So that is compostable, and that has a timeline of 90 to 180 days. And in composting conditions, if the conditions are not made, it may take a little longer, but it won't take 5 years or 500 years in any way. So that is what is compostable, and we are the first company to get a certificate across the world for this compostability as per the international standard. And with our standard, we were invited to become the Bureau of Indian Standard Committee for Sanitary Pad. And after 30 years, the new standard was being made along with all multinational presence. We are the only startup. And then, because of our certificate, government then agreed to create a separate standard for biodegradability and compostability sanitary pads in the BIS, and that is being implemented now. We are promoting that, and what it means also, once you use a sanitary pad, you can dispose it off and create a small compost pit, which we can put either earthworms like vermicomposting method or even other composting method. Within 3 to 6 months, depending on the weather conditions, it will become manure. Even you can use it for that manure for plantation purpose. We do not recommend it use it for fruits, because your blood may have something which may create problem. But then for other kind of plantation like flowers and many other things, it can be very well used as a manure also.
Right.
So, yes,
on that note,
two aspects we have covered.
Right. On that note, thank you very much, Jaideep Mandal, Dr. Leela Joshi, Dr. Geeta Manjunath, for joining us in this program, sharing your amazing story. Many compliments to the amazing work that you and your teams are doing. Thank you very much for being a part of Changemakers. There is so much to learn from the work of our Changemakers, isn't it? How a society treats women is a reflection of its evolution. Our nature, our culture celebrates women in different roles, but in that spirit of celebration, let us not forget to treat our women, our girls, as an equal, whether it is about health or identity. Sometimes that's all it takes to be a change maker. Till we meet again, namaskar.